Welcome back. This segment is our cosmetic weight loss section. And here to help me talk about that is the Plastic Surgeons of Lexington, Dr. Lynch, Dr. Hill, and Dr. Moore. Welcome, guys.
Thank you.
All right. Now, I use the term cosmetic weight loss. Dr. Hill, that's really not, I mean, it's not, it's more body contouring, or tell me.
Correct. A lot of people come to our office thinking that we do weight loss surgery. That's not really what we are about. We typically contour the body after a weight loss surgery because people have extra skin, and to get rid of that skin, you have to, design patterns to get rid of it in a safe way, and that's really what we're trying to do. And that can be in the face, that can be in the arms, breast, tummy region, extremities.
Now, Dr. Lynch, the term everybody recognizes is tummy tuck. Who's a candidate for that? Other weight loss and other things too, correct?
Correct, yeah. So I think when you're looking at the optimal surgical candidate for a tummy tuck, obviously you want to take into account their BMI, so you want to be in the lower 30s, in that range there. You don't want to be too high there. You want to obviously be weight stable after your weight loss, so that's important because, like Dr. Quintero touched on weight loss surgery, you want to make sure you've lost the weight that you're going to lose and stay stable for a good 3 months or so, and then those people become very good candidates for all the surgery that we do. And obviously one of the big ones is the tummy tuck to address the weight loss skin in the abdominal region.
Okay. Now, other than weight loss, Dr. Moore, what kind of are there other reasons to do a tummy tuck?
If you're unhappy with your just general contour and you just have that extra skin, maybe you didn't lose a ton of weight, but maybe you've more popular the mommy makeover, where you've had a child and you've lost the weight, but that extra stretch or that extra skin is still there. Those are great candidates as well, and that's very popular to do.
Well, now, Dr. Hill, is this something you have to be in the hospital for? Is it outpatient? What kind of risk are there involved with that?
It's a good question. So obviously any surgery you do, there's a little bit of risk with it, but multiple studies, thousands of studies have actually shown that outpatient tummy tuck surgery, for instance, is just as safe as doing it in the inpatient. We try to make combinations of procedures together if someone has a lot of areas of concern, so you can combine body work with an arm lift or a body work with a breast procedure. So we try to minimize the total number of surgeries that someone has by working together.
Okay. Now, Dr. Lynch, he mentioned arm lift.
Mm-hmm.
Arm, thigh, bottom. I mean, tell me about that.
You can do all that. So someone who loses a lot of weight obviously essentially deflates, and so there's excess skin in multiple different areas, whether that's the arms, the thighs, the belly. With an arm lift, we're just contouring by removing excess skin. The same goes for thighs. If you have a lot of weight loss, you can remove excess thighs. We try to hide the scars in very acceptable areas, but it's mainly for a lot of people to wear clothing better and fit, and be more comfortable in their clothing when they're active and things like that.
Okay. Now, weight loss, you can see it in a lot of people's faces, Dr. Moore. I'm assuming you do facelifts. You do it for cosmetic, and do you do that for weight loss also?
Yes, but it's more considered cosmetic. But yes, you can do, it's more of a face and neck lift, because as you lose weight, you'll notice that it'll also happen in your face and neck. And so people like to address both of those at the same time, and that's very, very popular to do as well.
So what can somebody expect? They're not going to have assuming they're not going to have a six-pack. They're not going to look, like they were when they were 20-something years old. But what do they expect from the surgery results cosmetically?
Well, number one, a lot of times you're going to have a lot of scars, but typically those scars heal well, and over time they become, better. Six-pack can happen, but it takes a little bit more effort, like liposuctioning and things like that, as opposed to just cutting out extra skin.
Okay. Now, Dr. Lynch, he just mentioned liposuction. That's different.
It is different. I think that's an area that we use a procedure to contour certain areas to make it in a conjunction with removal of a lot of skin. It can also help contour an area, or that's your hips. You can use it in your arms, etc. But a lot of this for post-weight loss patients are going to be removal of excess skin. That's really where you get your best bang for your buck, is to remove all the skin that is now there after losing a considerable amount of weight.
So who might be a candidate for liposuction? If is it just mainly cosmetic instead of weight loss?
Yeah, I would put liposuction much more on the cosmetic side. For someone who's looking just to contour a little bit of an area to get it just looking a little better, that's going to be where liposuction comes in. It's not a weight loss procedure. It's a procedure to really help just kind of let someone, again, fit better in their clothing, etc. Whereas most of the operations we talked about here are after significant weight loss that you have to remove excess skin.
Well, that's great information. That's great information. If you've lost a lot of weight and want to look better, these guys can help you. We'll be right back.